Saudara, kanker hati merupakan salah satu kanker yang paling berbahaya, bahkan masuk sebagai 3 besar kanker yang paling mematikan di Asia. Namun begitu, kanker hati ini juga menjadi salah satu yang paling dapat dicegah jika terdeteksi secara dini. Mulai dari pola hidup, faktor risiko, hingga inovasi diagnostik dan terapi terkini ini, semua memiliki peranan yang penting dalam menyelamatkan nyawa pasien dari kanker hati. Nah, hari ini kita akan membahas bagaimana OncoCare Cancer Centre Singapore yang dikenal karena keahlian multidisiplin dan juga pendekatan yang berpusat pada pasien, ini menyediakan perawatan yang komprehensif bagi mereka yang menghadapi kanker hati. Dan bagaimana teknologi serta kolaborasi antar spesialis dokter ini bisa mengubah pengalaman dan meningkatkan kesempatan hidup bagi pasien kanker hati. Selama 30 menit ke depan, kita akan mengulasnya secara lengkap bersama saya Amanda Haj di Bincang Kita. Dan untuk membahasnya hari ini, saya sudah kedatangan dua narasumber saya luar biasa, yaitu Dr. Angela Pang, yang merupakan Senior Consultant in Medical Oncology from OncoCare Cancer Centre. Hello, Doctor.
Hello.
How are you?
Nice to meet you.
Nice to meet you too. And Dr. Juanda Leo Hartono, Senior Consultant in Gastroenterology and Hepatology in Mount Elizabeth Hospital, Orchard. Hello, Doctor.
Hi, Amanda.
How are you? Thank you so much for coming.
Thank you.
Okay.
Amanda. Yeah.
So, I'm excited today because we are talking about liver cancer. As we know that liver cancer is one of the most dangerous cancer in the world. Am I right?
That's right.
Yeah. Because according to the Global Cancer Observatory, liver cancer cases have doubled, with Asia having the highest number of liver cancer cases. Dr. Angela, before diving into causes and treatment, could you please explain to us how many types of liver cancer actually, and what are the most common types of liver cancer?
Yeah. So akin to what you had mentioned earlier, so it is true that Asia has the highest incidence of liver cancer. It accounts for basically about 70% of all cases worldwide.
70%?
Yes, that's a lot.
Oh, wow.
Yeah, exactly.
That's a lot.
So the incidence is actually particularly the highest in East and Southeast Asia, which basically includes Indonesia as well as Singapore. So, and unfortunately, liver cancer is quite a deadly disease. So it's also the second most common cause of cancer-related death in Asia. So, so we were talking about the different types of liver cancer. So basically, different types of liver cancer is based on the cells of their origin.
Okay.
So the most common type of liver cancer that we know is called hepatocellular carcinoma. It makes up about 75% of all liver cancers. It originates from the main liver cells within the cancer. And usually this is linked to like chronic liver disease like liver cirrhosis, hepatitis B, hepatitis C, as well as people who drink a lot of alcohol.
Oh.
Yeah, correct. So then the second type of liver cancer is otherwise known as cholangiocarcinoma. This is a lot rarer, and it comes from the bile ducts of the liver. Then basically these are cells, it comes from the cells lining the bile ducts that carry bile from the bile ducts from the liver into the digestive tract. So how it happens is basically some of the cells within this tract that drains the bile becomes cancerous, and then that develops into this cancer called cholangiocarcinoma, otherwise known as bile duct cancer.
Okay.
Yeah.
So,
then the third type, which is what we call liver metastasis. That means they are actually like cancer that spread from other places, then enter into the liver. So how they are treated is quite different. They are treated based on like where the origin of the cancer is, which is like, for example, common cancers that spread to the liver includes like colon cancer, breast cancer, lung cancer, and etc.
Okay. So there are three types of
Three main
cancer.
types.
Okay. So many liver cancer patients are diagnosed late. So only finding out after the cancer has advanced.
That's
Dr.
right.
Angela, what are the symptoms of liver cancer, and when should someone get checked further?
So that's a very good point. So the problem with a lot of cancers, and similarly liver cancer, is that very early symptoms are very subtle and very easily missed, so people don't realize. So some of these subtle symptoms to watch out for would include, for example, if you have unexplained weight loss, that means you're not deliberately trying to lose weight and suddenly you lose like 5 kg, 10 kg over a period of time. Or if you lose appetite, you can't seem to eat very much and you feel full very quickly. Or if you have this very vague abdominal pain tummy pain that does not go away. So that's also worrying. Some people get swelling in the abdomen and the tummy becomes a bit bigger.
Oh.
Yeah, and there's also some patients who have persistent symptoms like nausea and vomiting. So these are some of the early symptoms. Then we move on. The later symptoms of liver cancer would include things like jaundice. So patients will become a bit yellowed.
Yellow skin?
Correct, yellowing of the skin.
Okay.
Then they get itch of the skin because some of this jaundice bile, it accumulates inside the skin, so it becomes very itchy. Then last but not least, they start to realize that the urine color becomes very dark, like color of tea. Yeah, or their stools become very, very white. So these are some of the later symptoms of liver cancer. And so basically, if anyone noticed, if like anybody notices some of these symptoms, especially abdominal pain, jaundice, and all that, or unexplained weight loss, really we would encourage people to see a doctor as early as possible, just to at least get a workup. Hopefully they can detect the cancer early instead of later.
Yeah, I agree with that. But doctor, some symptoms of liver cancer are actually similar to those of other disease. For example, like lose weight, lose appetite. It's also a symptom of diabetic. I mean,
correct.
Am I correct?
You are right.
And also the itchy skin is also similar to the symptom of kidney failure. So am I correct? How can we differentiate them?
Well, I guess as it is more like for patients to realize that these are symptoms that should not happen. So if it persists beyond a month and you keep having this despite like trying some over-the-counter remedies and such, this is really time to go and see your doctor for a check. So because we are medically trained, so if let's say they were to examine, doctors were to examine you and they do a simple blood test, they would really be very quickly able to differentiate whether this is kidney problem or whether this is a liver problem.
I see, I see, okay. So now we move on to Dr. Juanda. So as I mentioned earlier, that liver cancer is one of the most common cancer affecting Asians, right? It's based on data also.
That's right,
Why is this happening, doctor? And what are the main factors causing liver cancer? And how important is regular screening for those at high risk, as we are Asian?
Yeah, so the most common risk factor for Asia for the liver cancer is actually hepatitis B. So a long-standing chronic inflammation of hepatitis B will eventually lead to liver scarring and liver hardening. In medical term, it's called cirrhosis. So this condition will predispose patient to develop further into cancer if it's untreated. So we have more common hepatitis B in this part of the world as compared to the Western countries. Of course, other risk factors includes hepatitis C as well. It's another type of viral hepatitis. And in addition to that, as recently we are getting more and more fatty liver.
Fatty liver,
because which also increase along with diabetes and obesity. So this itself will pose the patients to be at risk of liver cirrhosis in the future. So it's now gaining traction to become one of the more significant cause for liver cancer as well. So these are the risk factors, a liver-specific risk factor. In addition to that, the non-liver specific includes smoking. It's very important. I mean, smoking causes cancer everywhere, but also in liver. And of course, in addition to that, also family history of liver cancer.
Okay. So in your opinion, how can we increase awareness about the importance of early detection? Because this is very important and to reduce the percentage of late-stage diagnosis.
Yeah, I think it's very important to understand that we cannot rely on symptoms for liver cancer. If you do have symptoms, you definitely have to go for early investigation. But even if you don't, and if you think you're at risk for liver cancer, as I have mentioned before, you have risk factors for liver cancer, it's good to go and check whether you need regular screening, even without symptoms. Because the issue is that a lot of early stage liver cancer, when they are very small, they don't really affect the nerve in the liver. So you don't get the pain, you don't get the blockage in the bile duct to cause jaundice. There's just not many things that you can get. But this is exactly the stage where you can still cure the patients with certain treatments. So therefore, if you can pick these cancers early by doing a regular screening when they are still have no symptoms, this is actually a window of opportunity to get the best treatment, more treatment options, and even get a cure for liver cancer.
Oke. In bahasa Indonesia, mencegah lebih baik daripada pengobati. Am I correct?
Betul sekali. Ya.
Okay, thank you. I still have a few questions, but let's take a break for a moment, doctors. Ya, jadi saudara jangan kemana-mana, tetaplah bersama kami di Bincang Kita.
Amerika Serikat dan Iran resmi menaikkan kesepakatan damai, Selat Hormuz dibuka kembali. Beredar unggahan yang mengklaim pembatasan pembelian BBM jenis Pertalite maksimal Rp50.000 khusus untuk sepeda motor. Seorang intel yang masuk ke kampus Universitas Muhammadiyah Yogyakarta saat mahasiswa berunjuk rasa ditangkap. News or Hoax, Sabtu 20 Juni pukul 12:30 siang di Kompas TV. Geopark Kebumen menyimpan jejak jutaan tahun perjalanan bumi. Namun di balik pengembangan kawasan yang terus berjalan, warisan geologi berisiko terancam jika konservasi diabaikan. Lalu mampukah pelestarian berjalan beriringan dengan pembangunan?
Dari batu kita bisa tahu tentang sejarah bumi kita.
Perizinan pertambangan dalam area tersebut juga dicabut kalau misalnya terlalu membahayakan untuk wilayah konservasi.
60 menit special report Minggu 21 Juni pukul 6 petang di Kompas TV.
Terima kasih masih bersama kami di Bincang Kita, saudara. In the previous segment, Dr. Juanda, we discussed about what liver cancer is, the causes, and also the importance of liver cancer screening. Now, let's talk about the treatment. So, actually, what treatment options are available for liver cancer patient, doctor?
So we do not have a lot of treatment options nowadays as compared to before. So first, we always aim for cure for the liver cancer. And this is traditionally going to be surgical options, whereby you remove the cancer out from the liver. Now, this is feasible if the cancer is still not widespread. But of course, if the cancer is too big or there are multiple cancers in multiple locations in the liver, it's not possible to remove the entire part of the liver.
Yeah.
And therefore, in this case, you can still achieve cure by removing the entire liver and place a new liver into the body, which is called a liver transplant. So that is what we call the surgical options. But things have actually improved quite a fair bit recently. So if the cancer is picked up very early, very small, we can use a needle and insert through a skin and reach the cancer in the liver, and then we apply heat to burn the liver cancer when it is small enough. Of course, it can only be cured if we can encase the entire tumor within that heat generated. So the heat is generated through radio frequency, or more recently we can even use microwave ablation to kill the tumor cells.
Okay.
So those are the non-invasive options, and in addition to that, we can also instill chemotherapy directly to the liver tumor. So this is done by inserting a catheter through the skin, go into the blood vessels, and through the blood vessel we find a feeding artery or feeding blood vessels that give nutrition to the liver cancer. And through that blood vessels we administer chemotherapy directly to the tumor cells. Or we can even administer radiotherapy by administering radioactive kind of particles inside it, so that it can generate the radioactive radiotherapy inside the tumor cell itself, inside the liver. So those are the non-invasive kind of like surgical, non-surgical, non-invasive local treatment for the liver tumor.
Okay.
And this is also called what we call local regional treatment.
Okay, so this is non-surgical local regional therapy.
That's right.
Oh,
yeah.
okay.
So it just means that this treatment is really meant to directly target the liver cancer itself without going much to the body.
Okay.
Yeah. The most recent advances that is gaining traction nowadays is also radiotherapy from the outside. From the outside, you can also do radiotherapy. It used to be a bit difficult to do, but now we have a new technique called tactic radiotherapy that you can use that radiotherapy directly to target the liver precisely.
Oh.
Yeah. The one that is the latest technique is using proton therapy.
Proton therapy.
Proton
What is
therapy.
that?
Proton therapy is a type of radiotherapy that basically is even more precise.
Uh-huh.
It is intended to just kill the tumor cells
Okay.
without affecting the surrounding liver
Oh.
tissue. So therefore, you can expect less side effects on the radiotherapy if you use proton therapy itself.
So what factors determines the most appropriate non-surgical local regional therapy for a liver cancer patient, doctor?
Yeah, so it all depends on many factors. The patient factor, whereby the age, the
age, okay.
age, the whether they have any other disease,
Uh-huh.
are they frail, are they healthy enough, is the liver function is still good.
Okay.
Yeah, so those are the patient factor. In terms of the tumor itself, we also look at the size as mentioned before. So and also the location. So for example, yeah, if the location is very near to the lungs or to the blood vessels, and you are thinking about doing needle ablative therapy to burn the liver, we are concerned that it can actually damage the surrounding lungs or the blood vessels or the, as well. So then that may not be suitable for those treatment, and therefore we then have to switch to, let's say, using the chemotherapy through the artery, the one that I mentioned earlier. We can call the short form as TACE, or transarterial chemoembolization, whereby we can administer the chemotherapy direct to the liver cancer. But then again, if you have issues with reaching or navigating through the artery, or that you have blockage in the artery, for example, then they may not be feasible as well.
Yeah.
Right. So it all depends on multiple factors that will make our decision on which treatment to go. Even surgical therapy itself will depends on whether it is easily resected, whether there are one or if there are multiple sites in the tumor. That will also make the surgical therapy not feasible. And we sometimes are concerned about the liver function, the residual.
Function.
Yeah. So when we resect the liver out, we have to think about whether the remaining liver function is adequate for function.
Okay.
So we try. When the patient have a poor liver function, we tend not to go for surgery because we are worried that if you remove one part of the liver, the remaining liver is not good enough to function for the patient.
Dr. Ejara, so like chemotherapy, targeted therapy, like Dr. Juanda said, and also immunotherapy. So how do you decide which combination works best for each patient?
Yeah, so that's a very good question. So we usually believe in personalizing treatment for each individual patient, and that usually requires us to understand the patient's medical condition because every person's situation is quite unique. So some of the important key factors that would help us guide us in selecting the most appropriate and effective treatment plan includes number one, the type of liver cancer and also the stage. Because as I had mentioned earlier, the most common type of liver cancer, otherwise known as hepatocellular carcinoma, is managed quite differently from cholangiocarcinoma. The type of medications used and the staging of the disease is quite different. So as Dr. Juanda has alluded to earlier, the stage of the disease is very important. So that's why we say you must screen and detect early, because usually early stage cancer, you can cut it out, you can give local regional treatment to burn the tumor. You can even go as far as liver transplantation. Whereas people with more advanced cancer stages, they usually need to receive long-term medications like targeted therapy, immunotherapy in order to control the disease. Then point number two would be, similarly as Dr. Juanda had mentioned earlier, one, liver function and overall health is very important. So some people may have chronic liver condition, so the liver function is not very good. So we need to be aware of that and how much treatment we can give, whether it will affect the long-term liver function. And then point number three would then be the fact that we have a lot of advances in precision medicine nowadays. So a lot of people may have read about it on internet and such. So basically what this means is we directly take the tumor tissue, we test it in the lab, and we check whether there's any molecular mutation or whether there's anything what we call biomarkers, so that it can allow us to look at this, understand your tumor and directly identify what is the best treatment that can be given to each individual patient. So it goes down very finely into the molecular characteristics of the tumor.
Okay, so can you tell us how OncoCare's multidisciplinary tumor board helps formulate a personalized treatment plan for every liver cancer cases?
So that's a very important thing. So after we have collated all the information that I mentioned earlier about the stage of the disease, the molecular characteristics, we actually sit down for a comprehensive review by what we call our multidisciplinary tumor board. So this is where the strength of collaborative care comes to life. So what this tumor board comprises of is multiple specialists. They are all people in their own area of specialty, putting all their expertise together to be able to kind of provide opinion on how best to manage these patients. So we have, for example, like Dr. Juanda, hepatologist, we have surgeons, we have medical oncologists, we have radiation oncologists, we have radiologists and pathologists. So you just imagine, for an illness, you see one doctor, whereas for a multidisciplinary tumor board, we actually collectively bring together 7 or 8 different specialists to discuss your case, each individual person. Essentially, every patient that we manage, we bring to a tumor board to discuss. So every expert contributes their opinion, ranging from understanding the liver health and everything. Then we put all these insights together. Then we put all these brains together, and then we reach a consensus on what's the best treatment option that is possible for the patient.
Oh, wow, interesting, Doctor. I still have a few questions for doctors. Of course, Dr. Angela and Dr. Juanda, but let's take a break for a moment, okay? So, saudara jangan kemana-mana, tetaplah bersama kami di Bincang Kita.
Di balik gedung pencakar langit dan hutan beton, satwa burung bertahan hidup di Jakarta. Aksi konservasi serta pengamatan burung liar di rimba kota ini kini tumbuh di kalangan anak muda. Peminatnya pun tak kalah dengan komunitas penggemar burung kicau alias kicau mania.
Latik batu abu sama bentet kelabu. Dulu ini masih sering terlihat di pesisir Jakarta, tapi akhir-akhir ini kita udah sulit untuk menemukan itu di alam.
Sustainasia, kicau burung di rimba kota, Sabtu 20 Juni pukul 9 pagi di Kompas TV.
Kenapa tidak membiarkan diskusi itu berjalan secara tuntas? Kenapa harus dengan menggeruduk diskusi itu?
Karena sedari awal kami melihat acara tersebut bukan diskusi.
Yang terjadi adalah pada saat Mas Budiman sedang bicara, teman Anda tuh langsung berteriak, Anda pengkhianat, sampai mengatakan revolusi, revolusi. Saya ingin mengingatkan, hati-hati dong bro, kalau ngomong revolusi, revolusi.
Siapa pihak di balik gerakan BEM Bersatu ini?
Rosi, Sabtu 20 Juni, pukul 10 malam di Kompas TV.
Kembali lagi di Bincang Kita, saudara, masih membahas mengenai kanker hati bersama dengan Dr. Juanda dan juga Dr. Angela di sini. So, Dr. Juanda, liver cancer often affects older patients with other health issues. Am I right?
That's right.
Yes. So, how do you optimize their liver health alongside with their cancer treatment?
So it is known that for elderly or older patients, they have other disease like diabetes or heart disease, and they also have frailty. Now, in this case, sometimes they have a poor liver function, and our main role is really just to ensure that they have adequate liver function, because when they go through a treatment such as immunotherapy or surgery or any of the treatment that I mentioned before, it tends to affect the liver function as well. So we need to assess whether their liver function is adequate to handle all this treatment, and secondly also to optimize the care for the underlying liver disease and to continue the treatment. Of course, liver disease can also cause complications, and if these arise, such as electrolyte imbalances, we also can help optimizing or correcting all this before they undergo their cancer treatment.
Oh, I see. So what lifestyle advices will you give to patients with liver cancer to help maintain their liver health, doctor?
Very importantly is to stop smoking.
Stop smoking.
That's very important. And secondly is to avoid alcoholic beverage or alcohol drinking.
Oh, stop alcohol drinking.
Yes.
Okay.
Okay, that is the most important. Secondly, it is also important to understand that, just as Dr. Angela mentioned, patients tend to have weight loss, so their nutrition is already very poor when they have liver disease or liver cancer. And when they go through all this treatment for cancer, they can further lose their nutrition as well. So it's very important for them to ensure that their nutrition is adequate, and by taking supplement energy drink, for example, if need to, certain supplement drink. Along with that, it's also important to choose more protein as opposed to others. Yes.
Oh, I see.
Healthy protein, things like lean meat or fish or tofu. And for this patient, it is advisable for them to split their meal. So instead of taking only 3 times a day, it's preferable for them to take more frequent but smaller amount of meal to prevent the fasting period, so that their muscle is not broken down.
Okay, it's better to have a small portion,
But more frequent. Including the late evening snack before dinner, so that they don't have this period of prolonged fasting. Yeah.
How about the food? Many people say that sugar is the main food for cancer. So is that correct?
Well, sugar is a type of processed food in some way, and it actually leads to diabetes and also fatty liver. So yes, it is correct, but the key is also to avoid taking food that is processed or ultra processed.
Ultra processed.
So it is advisable for patients to take more fresh or healthy food, more fresh food, more vegetables, instead of taking things off the the supermarket counter that is ultra processed, for example.
Okay, so it's mandatory to avoid ultra processed food.
That's right.
Okay.
Yes.
So let's move on to Dr. Angela. So OncoCare is known for its expertise in geriatric oncology. So how do you personalize treatment for elderly patients who might not tolerate standard chemotherapy, doctor?
Okay, so Amanda, that's a very good question. So usually elderly patients with liver cancer, they require very personalized care, because age alone as a number does not determine whether one is suitable for treatment or not. So OncoCare has a geriatric oncology team. So we look after old people, and we help to tailor the treatment to each individual by assessing their overall health, other medical problems, how frail they are, whether their cognition, their brain is intact, and how is the psychosocial setup. So we do this thing called a comprehensive geriatric assessment, so that allows us to understand the patients better as a person, their preferences, and also their other medical problems. So it allows us to guide the treatment by identifying what are some of the risk factors and what are some of the reversible issues. Like for example, Dr. Joanda mentioned malnutrition, and if let's say they've got medication problems, medicines that can overlap. So we try to correct all these things so that we can put them in a more optimal state to start treatment. And then we also then try to come up with a treatment that can balance the benefit against the toxicity of treatment. So by putting together also a multidisciplinary team, so now not just doctors, but we also have pharmacists, allied health like physiotherapists and nursing team. So it allows us to come together as a team to support the patient and their family. So ultimately the goal is really to be able to treat the patient to the best optimal outcome, to avoid under treatment, meaning we don't want to deny the patients of the potentials of treatment, and it's also to prevent over treatment, which can cause excessive toxicity, and then we maintain the patient's independence and their quality of life when they're undergoing treatment. So that's the most important thing in the end for most people. They want to survive the cancer, but they also want to maintain their independence.
Okay. So what gives you hope for the future of liver cancer patient, doctor, especially the treatment, the innovation, and the patient care?
So, I mean, we see liver cancer patients every day. So we strongly feel that the future of liver cancer treatment is really very bright. So over the last 10 to 20 years, the advances in both surgical and also ablative techniques have improved tremendously. So previously there are a lot of very difficult to reach tumors, and now we can even tackle them and we can reach them. And then now we have precision medicine as well. So it allows us to understand the tumor better, so we can tailor the treatment to be more effective, less toxic. So now we have immunotherapy, targeted therapy that can improve outcome. And then all over the world, there's also ongoing clinical trials that continue to expand options. So by knowing all this, and then we put together a multidisciplinary team with patient-centered care, where all our specialists and such will tackle the patient's medical problems, emotional needs, as well as their lifestyle needs. So with a better early detection, right, allows us to understand the tumor. We have time to personalize the therapy, and we give holistic support. So with all that, patients can actually look forward to a longer, healthier, and improved quality of life in general.
Oh wow, thank you so much. What an interesting conversation here. Thank you so much once again, Dr. Angela, Dr. Joanda. Thank you for the information that we understand right now that actually liver cancer patients still have a quality of life, still have a hope to get better, right? So yeah. Thank you so much for joining us on Kompas TV. Nah, saudara, kanker hati mungkin menakutkan, namun pengetahuan dan deteksi dini adalah senjata terkuat kita. Harapan selalu ada ketika ilmu pengetahuan, kasih sayang, dan juga teknologi berpadu dalam satu tujuan, kesembuhan dan kualitas hidup yang lebih baik. Jika Anda ingin mengetahui lebih lanjut, silakan akses ya laman website di bawah ini dan sosial media yang tertera. Saya Amanda Hatch pamit undur diri, sampai jumpa di bincang kita selanjutnya.
Terima kasih Anda telah menyaksikan Bincang Kita, dipersembahkan oleh